California RDA Practice Test Dental Assistant Exam Prep. Question 1. Which of the following is not located within the oral cavity? Here are the options. Option A. Hard palate. Option B. Frenum. Option C. Gingiva. Option D. Pterygoid process. The correct answer is option D. Pterygoid process. The pterygoid process is a projection of the sphenoid bone in the skull, not a structure within the oral cavity. Question 2. How often should a patient be asked to update their medical and dental history? Here are the options. Option A. Every visit. Option B. Every 6 months. Option C. Annually. Option D. Only when something changes. The correct answer is option A. Every visit. The medical and dental history should be reviewed at every visit so changes in medications, conditions, and treatment needs are identified before care. Question 3. Which of the following would be least likely to be found on the clinical examination form? Here are the options. Option A. Temporomandibular joint evaluation. Option B. Dates of loss of primary teeth. Option C. Dates of tooth extractions. Option D. Information on crowns or bridge work. The correct answer is option B. Dates of loss of primary teeth. Dates of primary tooth loss are not typically part of an adult clinical examination form, while joint evaluation, extraction history, and restorations are relevant findings. Question 4. Which of the following vital signs would be cause for concern during dental treatment? Here are the options. Option A. Blood pressure of 140/90 millimeters of mercury. Option B. Respiratory rate of 18 breaths per minute. Option C. Pulse of 70 beats per minute in an adult. Option D. Oral temperature of 99 degrees Fahrenheit. The correct answer is option A. Blood pressure of 140/90 millimeters of mercury. A blood pressure reading of 140/90 millimeters of mercury may indicate hypertension and should be evaluated before dental treatment proceeds. Question 5. According to the universal numbering system, where is tooth 21 located? Here are the options. Option A. Upper right cuspid. Option B. Lower right lateral incisor. Option C. Upper left second molar. Option D. Lower left first bicuspid. The correct answer is option D. Lower left first bicuspid. In the universal numbering system, tooth number 21 is the lower left first premolar, also called the lower left first bicuspid. Question 6. In the positioning of the dental assistant for four-handed dentistry, which of the following is not recommended? Here are the options. Option A. Eye level is positioned 4 to 6 inches above the dentist's eye level. Option B. Feet are placed on the foot ring or base of the stool, and the stool is positioned close to the dental chair. Option C. Legs are together, seating position is close to the back of the stool, feet planted firmly on the floor. Option D. Stool position close to the dental chair with legs parallel to the dental chair. The correct answer is option C. Legs are together, seating position is close to the back of the stool, feet planted firmly on the floor. The assistant should not sit with legs together and feet planted on the floor because proper four-handed dentistry uses an elevated stool, foot support, and close positioning. Question 7. What is the name of the right-handed operating zone from 4 o'clock to 7 o'clock? Here are the options. Option A, operator's zone. Option B, transfer zone. Option C, assistance zone. Option D, static zone. The correct answer is option B, transfer zone. For a right-handed operator, the area from 4 o'clock to 7 o'clock is the transfer zone used for passing instruments. Question 8. What is the name of the instrument that includes the following types? Straight, binangle, Whittlesteet, and analformer. Here are the options. Option A, excavator. Option B, hatchet. Option C, gingival trimmer. Option D, chisel. The correct answer is option D, chisel. Straight, binangle, Whittlesteet, and angleformer are design types associated with chisels. Question 9. What type of instrument is a burnisher? Here are the options. Option A, restorative. Option B, accessory. Option C, basic. Option D, hand cutting. The correct answer is option A, restorative. A burnisher is a restorative instrument used to smooth, contour, or polish restorative material. Question 10. A patient undergoing a procedure of approximately 30 minutes will most likely require which of the following types of anesthetics? Here are the options. Option A, bupivacaine. Option B, prilocaine hydrochloride block. Option C, novocaine. Option D, lidocaine hydrochloride. The correct answer is option D, lidocaine hydrochloride. Lidocaine hydrochloride is commonly selected for procedures lasting about 30 minutes because it provides an appropriate duration of local anesthesia. Question 11. What type of procedure would include the following instruments: matrix setup, burrs, saliva ejector, high-volume evacuator, dental dam setup, and local anesthetic setup? Here are the options. Option A, extraction. Option B, root canal. Option C, Class II amalgam restoration. Option D, incision and drainage. The correct answer is option C, Class II amalgam restoration. A Class II amalgam restoration commonly requires a matrix setup, burrs, evacuation, dental dam materials, and local anesthetic setup. Question 12. What type of instrument is used to remove enamel during the placement of a veneer? Here are the options. Option A, condenser. Option B, diamond burr. Option C, evacuator. Option D, carver. The correct answer is option B, diamond burr. A diamond burr is used to remove enamel efficiently during veneer preparation. Question 13. What type of instrument is used by the dentist to lower the height of the tooth during preparation for a crown? Here are the options. Option A, bevel instrument. Option B, carver. Option C, high-speed handpiece. Option D, ultrasonic handpiece. The correct answer is option C, high-speed handpiece. A high-speed handpiece is used to reduce tooth structure and lower the height of a tooth during crown preparation. Question 14. The air abrasion handpiece is least likely to be used in which of the following procedures? Here are the options. Option A, gingival retraction. Option B, external strain removal. Option C, sealants. Option D, Class II preparations. The correct answer is option A, gingival retraction. Air abrasion is not typically used for gingival retraction because it is designed for tooth surface preparation and stain removal rather than tissue displacement. Question 15. Which of the following supplies would most likely not be used for taking a mandibular preliminary impression? Here are the options. Option A, wide blade spatula. Option B, biohazard bag. Option C, alginate measure scoop. Option D, polycarboxylate. The correct answer is option D, polycarboxylate. Polycarboxylate is a cement, not a material normally used to take a mandibular preliminary impression. Question 16. Which of the following is not true regarding the application of topical fluoride foam? Here are the options. Option A, patients should be instructed not to swallow the fluoride. Option B, patients may eat or drink right away. Option C, the teeth should be dry before the fluoride foam is applied. Option D, a double arch tray may be used to apply fluoride to both arches at the same time. The correct answer is option B. Patients may eat or drink right away. Patients should not eat or drink immediately after topical fluoride foam because the fluoride needs time to remain on the teeth. Question 17. The vitality test is used to measure the health of? Here are the options. Option A, enamel. Option B, dentin. Option C, pulp. Option D, root. The correct answer is option C, pulp. A vitality test evaluates the health and responsiveness of the dental pulp. Question 18. When applying a topical anesthetic ointment in preparation for the dentist to give an injection, what is the longest length of time the topical ointment will provide optimal effectiveness? Here are the options. Option A, 1 minute. Option B, 2 minutes. Option C, 5 minutes. Option D, 7 minutes. The correct answer is option B, 2 minutes. Topical anesthetic ointment usually reaches optimal effectiveness for about 2 minutes before injection. Question 19. Which of the following is true about the administration of nitrous oxide and oxygen? Here are the options. Option A, the patient should be encouraged to breathe through the mouth in order to maximize the effectiveness of nitrous oxide and oxygen. Option B, once the dosage is determined for nitrous oxide and oxygen, the same dosage can be used at subsequent dental visits. Option C, the nitrous oxide and oxygen procedure should end with the administration of 100% pure oxygen for at least an hour. Option D, administration of nitrous oxide and oxygen should begin with 100% pure oxygen. The correct answer is option D. Administration of nitrous oxide and oxygen should begin with 100% pure oxygen. Nitrous oxide and oxygen administration begins with 100% oxygen to establish baseline breathing and patient comfort. Question 20. When assisting with the delivery of a partial denture, which of the following is not something a dental assistant would be responsible for? Here are the options. Option A, adjusting the tension on the retainer. Option B, Disinfecting the prosthetic before it is placed in the patient's mouth. Option C. Placing articulating paper in the patient's mouth in order to check the occlusion. Option D. Polishing the prosthesis before delivering it to the patient for instruction on use. The correct answer is option A. Adjusting the tension on the retainer. Adjusting retainer tension is a dentist's responsibility because it changes the fit and retention of the partial denture. Question 21. When assisting with root canal therapy, what is the first instrument the dentist will need to enter the coronal portion of the tooth? Here are the options. Option A. Carbide round burr. Option B. Endodontic explorer. Option C. Reamer files. Option D. Dental broach. The correct answer is option A. Carbide round burr. A carbide round burr is commonly used first to gain entry into the coronal portion of the tooth during root canal therapy. Question 22. When assisting with a scaling procedure for periodontal debridement, what instrument is used by the dentist to remove supragingival and subgingival calculus? Here are the options. Option A. Profi angle. Option B. Kirkland knife. Option C. Gracie curette. Option D. Theriotome. The correct answer is option C. Gracie curette. A Gracie curette is designed to remove supragingival and subgingival calculus during periodontal scaling. Question 23. Which of the following statements would be the most effective in communicating with an apprehensive patient? Here are the options. Option A. The next sound you hear will be the drill. Option B. We are preparing the tooth for restoration. Option C. You will likely feel a little pain initially, but it will subside once the anesthetic kicks in. Option D. I'm applying a topical anesthetic before the dentist comes in to give you the shot. The correct answer is option B. We are preparing the tooth for restoration. Saying that the tooth is being prepared for restoration uses calm, neutral language and avoids words that may increase fear. Question 24. What is the least effective strategy a dental assistant can take to assist a hearing-impaired patient in understanding instructions? Here are the options. Option A. Remove the mask before speaking to allow the patient to see the lips. Option B. Try to reduce other noise in the area when trying to communicate with the patient. Option C. Use written illustrations and handouts for the patient to read. Option D. Speak very loudly so the patient can hear you better. The correct answer is option D. Speak very loudly so the patient can hear you better. Speaking very loudly is usually ineffective for hearing-impaired patients and may distort speech cues. Question 25. Which of the following may be contraindicated in a patient with severe hypertension? Here are the options. Option A. Fluoride. Option B. Nitrous oxide. Option C. Levonorepinephrine. Option D. Lidocaine. The correct answer is option C. Levonorepinephrine. Levonorepinephrine can increase cardiovascular stress and may be contraindicated for patients with severe hypertension. Question 26. Which of the following would not be the first choice for managing a reluctant child during a routine cleaning appointment? Here are the options. Option A. Ask the child to hold and assist with the saliva ejector. Option B. Involve the child in a procedure, such as selecting a flavor of fluoride or toothpaste. Option C. Use a papoose board. Option D. Allow the parent to stay in the room to help keep the child calm. The correct answer is option C. Use a papoose board. A papoose board is a restrictive behavior management method and would not be the first choice for a reluctant child at a routine cleaning. Question 27. A patient who has had a heart transplant comes in for a dental procedure. He has a penicillin allergy but needs to take prophylactic antibiotics prior to the procedure. Which antibiotic would most likely be prescribed? Here are the options. Option A. Amoxicillin. Option B. Erythromycin. Option C. Ampicillin. Option D. Cefixaxone. The correct answer is option B. Erythromycin. Erythromycin is the best option listed for a patient with a penicillin allergy who requires prophylactic antibiotics in this flashcard set. Question 28. Which of the following dental products would not be used for a final impression? Here are the options. Option A. Alginate. Option B. Polysulfide. Option C. Polyether. Option D. Silicone. The correct answer is option A. Alginate. Alginate is mainly used for preliminary impressions and study casts, not final impressions. Question 29. Which of the following is the last step in the preparation and application of a composite resin material? Here are the options. Option A. Have the liquid bonding resin available for use by the dentist. Option B. Use the cure light. Option C. Apply final carving touches. Option D. Select the appropriate shades of composite. The correct answer is option B. Use the cure light. Using the curing light is the final step because composite resin must be polymerized after placement and shaping. Question 30. What is the proper ratio for mixing a non-eugenol dressing? Here are the options. Option A 1/4 base and 3/4 accelerator materials. Option B 1/4 accelerator and 3/4 base materials. Option C 2 parts base to 1 part accelerator material. Option D equal parts base material and accelerator material. The correct answer is option D. Equal parts base material and accelerator material. Non-eugenol dressing is mixed using equal parts base material and accelerator material. Question 31. Which type of polishing agent is the best choice for polishing porcelain? Here are the options. Option A. Sapphire polishing paste. Option B. Aluminum oxide paste. Option C. Silex. Option D. Fluoride paste. The correct answer is option A. Sapphire polishing paste. Sapphire polishing paste is appropriate for polishing porcelain surfaces. Question 32. Which of the following statements is false concerning light-cured sealant application? Here are the options. Option A. Poor sealant retention on the tooth surface may be due to contamination of the sealant with saliva during application. Option B. Dental dams or cotton rolls will help to maintain a dry field when applying sealants. Option C. Shining the curing light for 30 seconds will be the appropriate length of time to cure all surfaces that have been sealed. Option D. Use floss to make sure there is no sealant in contact with the interproximal area of the teeth. The correct answer is option C. Shining the curing light for 30 seconds will be the appropriate length of time to cure all surfaces that have been sealed. The statement is false because curing time depends on the sealant material and surface, so 30 seconds is not automatically correct for all surfaces. Question 33. What type of product is optimal for use in study models for the fabrication of a dental bridge? Here are the options. Option A, dental stone. Option B, plaster of Paris. Option C, alginate. Option D, densite. The correct answer is option D, densite. Densite provides the strength and accuracy needed for study models used in bridge fabrication. Question 34. What would be the appropriate type of wax to select for setting denture teeth? Here are the options. Option A, casting wax. Option B, baseplate wax. Option C, inlay casting wax. Option D, utility wax. The correct answer is option B, baseplate wax. Baseplate wax is commonly used when setting denture teeth during denture fabrication. Question 35. All of the following are true about plaque formation except. Here are the options. Option A, the bacteria responsible for plaque formation are mutant streptococci and lactobacilli. Option B, proper brushing and flossing can remove plaque. Option C, the action of saliva will remove any remaining plaque following flossing. Option D, potatoes and pasta promote plaque formation. The correct answer is option C. The action of saliva will remove any remaining plaque following flossing. Saliva does not reliably remove remaining plaque after flossing, so mechanical plaque control is still necessary. Question 36. What is the effect of chronic overexposure to fluoride? Here are the options. Option A, nausea. Option B, diarrhea. Option C, stomatitis. Option D, fluorosis. The correct answer is option D, fluorosis. Chronic overexposure to fluoride can cause fluorosis, which affects the appearance and mineralization of teeth. Question 37. Which of the following vitamins or minerals is not directly related to tooth formation? Here are the options. Option A, vitamin D. Option B, phosphorus. Option C, folic acid. Option D, magnesium. The correct answer is option C, folic acid. Folic acid supports general health, but is not directly tied to tooth formation in the way vitamin D, phosphorus, and magnesium are. Question 38. Which of the following statements would not be a recommendation given to parents to help reduce the risk of cavity formation in their 8-year-old child? Here are the options. Option A, drink juice or water instead of soda. Option B, avoid sticky foods such as raisins, dried fruits, granola bars, caramel, Skittles, and jelly beans. Option C, offer cheese as a snack or part of a meal. Option D, chew gum sweetened with xylitol. The correct answer is option A, drink juice or water instead of soda. Juice can still contribute fermentable sugars, so recommending juice instead of soda is not the best cavity prevention advice. Question 39. A patient has finished his first visit for crown placement. The provisional coverage has been placed on the tooth in preparation for the crown placement. All the following are appropriate instructions to the patient except. Here are the options. Option A. Avoid sticky foods. Option B. Floss carefully and gently slide the floss between the temporary crown and the adjacent tooth. Option C. Be careful chewing in the area of the provisional coverage to prevent damage from occurring to the temporary crown. Option D. If the temporary crown comes off, it is acceptable to wait until the next appointment to inform the dentist. The correct answer is option D. If the temporary crown comes off, it is acceptable to wait until the next appointment to inform the dentist. A temporary crown that comes off should be reported promptly because the prepared tooth needs protection before the next appointment. Question 40. Which of the following is used most frequently in a medical emergency? Here are the options. Option A. Oxygen. Option B. Spirits of ammonia. Option C. EpiPen. Option D. Nitroglycerin. The correct answer is option A. Oxygen. Oxygen is the emergency item used most frequently because it supports breathing in many medical emergencies. Question 41. A pregnant patient receiving dental treatment may experience which of the following after sitting up quickly in the chair? Here are the options. Option A. Postural hypertension. Option B. Hypoglycemia. Option C. Postural hypotension. Option D. Syncope. The correct answer is option C. Postural hypotension. A pregnant patient may experience postural hypotension when rising quickly because blood pressure can drop with sudden position changes. Question 42. A patient experiencing difficulty speaking, paralysis, vision impairment, or a sudden headache may be experiencing an. Here are the options. Option A. Myocardial infarction. Option B. Migraine. Option C. Cerebrovascular accident. Option D. Seizure. The correct answer is option C. Cerebrovascular accident. Difficulty speaking, paralysis, vision changes, and sudden severe headache are warning signs of a cerebrovascular accident. Question 43. A patient with type 1 diabetes is receiving dental care. The patient is complaining of dry mouth and a headache. You notice a fruity, acetone odor on the patient's breath. What is the appropriate action? Here are the options. Option A. Provide a source of concentrated sugar, such as orange juice or a sugar packet, to help raise blood sugar levels. Option B. You determine that the patient has skipped the morning insulin dose and assist the patient with insulin administration. Option C. Call 911 immediately. Option D. Call the patient's emergency contact. The correct answer is option B. You determine that the patient has skipped the morning insulin dose and assist the patient with insulin administration. Fruity acetone breath suggests hyperglycemia related to missed insulin, so the insulin history must be assessed and managed according to office protocol. Question 44. You observe creamy white lesions that look like cottage cheese on the tongue and cheeks of one of your patients. This patient likely has. Here are the options. Option A. Herpes zoster. Option B. Herpes simplex. Option C. Lichen planus. Option D. Oral candidiasis. The correct answer is option D. Oral candidiasis. Creamy white lesions resembling cottage cheese are typical of oral candidiasis. Question 45. Dental office employees may be at risk for certain types of occupational exposures to certain diseases. What type of hepatitis vaccination is required by Occupational Safety and Health Administration to be offered to these employees within 10 days of initial job assignment? Here are the options. Option A, hepatitis A. Option B, hepatitis B. Option C, hepatitis C. Option D, hepatitis D. The correct answer is option B, hepatitis B. The Occupational Safety and Health Administration requires hepatitis B vaccination to be offered to at-risk dental employees within 10 days of initial assignment. Question 46. What method for ordering supplies would be used to obtain the best discount on dental supplies while having to stock only a part of the order at any one time? Here are the options. Option A, automatic shipments. Option B, quantity purchase rate. Option C, reorder quantity. Option D, reorder point. The correct answer is option A, automatic shipments. Automatic shipments can allow discounted purchasing while spreading delivery, so the office stores only part of the order at a time. Question 47. What type of plan is necessary to assist with repairs for frequently used equipment in a dental office? Here are the options. Option A, manufacturer warranty. Option B, service contract. Option C, equipment records, including serial number and model. Option D, extended warranty. The correct answer is option B, service contract. A service contract helps cover repairs and maintenance for frequently used dental equipment. Question 48. What is the term used to describe the amount of money that must be paid toward the cost of dental treatment before insurance benefits will be activated? Here are the options. Option A, deductible. Option B, copayment. Option C, benefit eligibility. Option D, customary fee. The correct answer is option A, deductible. A deductible is the amount the patient must pay before insurance benefits begin. Question 49. Which of the following is not true about the State Dental Practice Act? Here are the options. Option A, the Act provides requirements for licensure and renewal of licenses. Option B, it specifies the duties that may be performed by a dental assistant or a dental hygienist. Option C, it specifies regulations and requirements surrounding infection control and radiation use. Option D, the Act is the same from state to state, but is enforced by individual state dental boards. The correct answer is option D. The Act is the same from state to state, but is enforced by individual state dental boards. Dental Practice Acts vary by state, so it is false that the Act is the same from state to state. Question 50. What is the name of the law that requires dental offices to have a written policy regarding patient privacy? Here are the options. Option A, Occupational Safety and Health Administration. Option B, Privacy Act of 1986. Option C, Health Insurance Portability and Accountability Act. Option D, Dental Practice Act. The correct answer is option C, Health Insurance Portability and Accountability Act. The Health Insurance Portability and Accountability Act requires dental offices to protect patient privacy with written policies. Question 51. Which of the following microorganisms cannot be treated effectively with antibiotics? Here are the options. Option A, Streptococcus. Option B, Staphylococcus aureus. Option C, Escherichia coli. Option D, Epstein-Barr. The correct answer is option D, Epstein-Barr. Epstein-Barr is a virus, and antibiotics are not effective against viruses. Question 52. A patient calls the morning of an appointment complaining of a fever, muscle aches, runny nose, cough, and headache. What is the appropriate action? Here are the options. Option A. Tell the patient he needs to come for the appointment, or he will be charged for a no-show. Option B. Tell the patient he may have the flu and should reschedule the appointment after the fever subsides without the use of medication. Option C. Reschedule for the following day. Option D. Tell the patient the decision is his to make about whether he feels up to coming in for dental work. The correct answer is option B. Tell the patient he may have the flu and should reschedule the appointment after the fever subsides without the use of medication. Flu-like symptoms should prompt rescheduling until the fever has resolved without medication to reduce disease transmission risk. Question 53. Which of the following is not a likely mode of transmission for herpes simplex virus type 1? Here are the options. Option A, blood. Option B, direct contact with a lesion. Option C, saliva. Option D, aerosol spray from the dental handpiece. The correct answer is option A, blood. Herpes simplex virus type 1 is commonly spread by saliva and direct lesion contact, not primarily through blood. Question 54. Which of the following is not correct regarding hepatitis B? Here are the options. Option A. Hepatitis B can cause serious illness involving the liver, including cirrhosis, liver cancer, or liver failure. Option B. Only individuals who are symptomatic can transmit the virus. Option C. More than 1/3 of all hepatitis cases are due to hepatitis B. Option D. Hepatitis B is transmitted through blood and saliva. The correct answer is option B. Only individuals who are symptomatic can transmit the virus. Hepatitis B can be transmitted by people who have no symptoms, so symptoms are not required for transmission. Question 55. What vaccination protects against lockjaw? Here are the options. Option A, measles, mumps, and rubella. Option B, H1N1 influenza. Option C, varicella. Option D, tetanus and diphtheria. The correct answer is option D, tetanus and diphtheria. The tetanus and diphtheria vaccine protects against tetanus, which is commonly called lockjaw. Question 56. In order for an infection to occur, 4 conditions must be present. Which of the following does not accurately describe one of these conditions? Here are the options. Option A, virulence. Option B, number of microorganisms. Option C, portal of entry. Option D, any available host. The correct answer is option D, any available host. An infection requires a susceptible host, not just any available host. Question 57. How is tuberculosis transmitted? Here are the options. Option A, airborne transmission. Option B, fecal-oral transmission. Option C, vehicular transmission. Option D, indirect transmission. The correct answer is option A, airborne transmission. Tuberculosis spreads through airborne transmission when infectious droplets are inhaled. Question 58. What is the single most effective means of preventing the transmission of disease in the dental office? Here are the options. Option A, use of gloves. Option B, use of a mask. Option C, proper hand hygiene. Option D, the use of antiseptic hand wash. The correct answer is option C, proper hand hygiene. Proper hand hygiene is the single most effective way to reduce disease transmission in the dental office. Question 59. What is the recommended duration for the use of antiseptic hand wash during hand hygiene? Here are the options. Option A 5 seconds. Option B 15 seconds. Option C 2 minutes. Option D 5 minutes. The correct answer is option B, 15 seconds. Antiseptic hand wash should be used for about 15 seconds during routine hand hygiene. Question 60. Frequent hand washing can cause dryness of the hands or dermatitis. What is the best way to treat this during the workday? Here are the options. Option A, avoid the use of any lotions during the workday. Option B, use of cocoa butter-based lotion. Option C, use of water-based lotion. Option D, use of petroleum-based lotion. The correct answer is option C, use of water-based lotion. Water-based lotion helps treat dryness while being more compatible with gloves than petroleum-based products. Question 61. A patient has a latex allergy. What should the dental assistant do for hand protection? Here are the options. Option A, wear a pair of gloves made out of nitrile or polyvinyl chloride materials. Option B, put the latex gloves on and wash the gloves with soap and water before treating the patient. Option C, wash hands thoroughly with soap and water and provide treatment without the use of gloves. Option D, wear the latex gloves and monitor the patient for signs of adverse effects. The correct answer is option A. Wear a pair of gloves made out of nitrile or polyvinyl chloride materials. Nitrile or polyvinyl chloride gloves provide hand protection for patients or providers with latex allergy. Question 62. What type of personal protective equipment should be worn while assisting with a procedure that requires the use of a high-speed handpiece? Here are the options. Option A, surgical scrubs, surgical hat, gloves, shoe covers, mask, and eye shield. Option B, surgical scrubs, gloves, and face shield. Option C, short-sleeved gown, gloves, surgical mask, and eye shield. Option D, long-sleeved gown, gloves, surgical mask, or face shield. The correct answer is option D, long-sleeved gown, gloves, surgical mask, or face shield. A long-sleeved gown, gloves, and a surgical mask or face shield protect against spatter from a high-speed handpiece. Question 63. Which of the following would be an inappropriate action regarding the use of personal protective equipment that requires laundering? Here are the options. Option A. Placing contaminated items that need laundering in a biohazardous waste container. Option B. Taking a contaminated surgical gown home for laundering following universal precautions. Option C. Changing a gown throughout the day whenever it becomes visibly soiled. Option D. Carefully removing the gown by pulling it off by keeping the gown inside out so it does not touch the clothing underneath. The correct answer is option B. Taking a contaminated surgical gown home for laundering following universal precautions. Contaminated protective clothing should not be taken home for laundering because it can spread contamination outside the workplace. Question 64. What is the name of the item used to prevent the patient from swallowing or aspirating dental debris during a procedure? Here are the options. Option A. Dental dam. Option B. Cotton roll. Option C. Dental clamp. Option D. Dental arch. The correct answer is option A. Dental dam. A dental dam helps prevent swallowing or aspiration of debris during treatment. Question 65. What is the basic concept that universal or standard precautions is based on? Here are the options. Option A. Standard precautions only apply to those individuals who have a history of infectious disease. Option B. Standard precautions only apply to those individuals who have a history of high-risk behavior, such as drug abuse or sexual orientation. Option C. Standard precautions apply to all patients and all bodily fluids should be treated as if infectious. Option D. Standard precautions only apply to blood and saliva based on the patient's history. The correct answer is option C. Standard precautions apply to all patients, and all bodily fluids should be treated as if infectious. Standard precautions treat all patients and body fluids as potentially infectious regardless of known history. Question 66. A dental assistant returns from the bathroom without washing hands and immediately puts on gloves. What type of disease transmission is possible? Here are the options. Option A. Patient to patient. Option B. Patient to the dental team. Option C. Community to dental office. Option D. Dental team to patient. The correct answer is option D. Dental team to patient. Failure to wash hands after using the bathroom can transfer microorganisms from the dental team to the patient. Question 67. What is the appropriate action to take when disposing of used needles in the dental office? Here are the options. Option A. Recap the needles using 2 hands, then dispose of them in a biohazardous waste bag. Option B. Handle the needles using gloves and dispose of them in a puncture-proof container. Option C. Cut the needles into tiny pieces and dispose of them in a puncture-proof container. Option D. Use gloves to handle the needles, put them into a resealable plastic bag, and dispose of them in biohazardous trash. The correct answer is option B. Handle the needles using gloves and dispose of them in a puncture-proof container. Used needles should be placed in a puncture-resistant sharps container to prevent injuries. Question 68. Which of the following would be considered an appropriate action for following aseptic technique? Here are the options. Option A. Removal of all jewelry. Option B. Long artificial fingernails. Option C. Use of steel wool to clean instruments. Option D. Use of vinyl gloves during dental procedures. The correct answer is option A. Removal of all jewelry. Removing jewelry supports a aseptic technique because jewelry can harbor microorganisms and interfere with hand hygiene. Question 69. When disposing of regulated waste, what set of regulations must be followed? Here are the options. Option A. Local. Option B. State. Option C. Federal. Option D. Whatever set of regulations is the most stringent. The correct answer is option D. Whatever set of regulations is the most stringent. Regulated waste disposal must follow whichever local, state, or federal rule is most stringent. Question 70. What type of system is used for storing clean and sterile instruments for use in specific dental procedures such as restoration? Here are the options. Option A. Tub and tray system. Option B. Color-coded system. Option C. Preset tray system. Option D. Accessory system. The correct answer is option C. Preset tray system. A preset tray system organizes sterile instruments for specific procedures such as restorations. Question 71. What is the term used for determining if sterilized instruments are still sterile before reuse? Here are the options. Option A. Event-related packaging. Option B. Terminal sterilization. Option C. Chemical indicator system. Option D. Biological monitoring system. The correct answer is option A. Event-related packaging. Event-related packaging means instruments remain sterile unless an event compromises the package. Question 72. After used instruments are transferred to the instrument's processing area and sorted, what is the next step in the sterilization process? Here are the options. Option A. Decontamination. Option B. Sterilization. Option C. Disinfecting. Option D. Cleaning. The correct answer is option D. Cleaning. After sorting, instruments must be cleaned before sterilization so debris does not interfere with the sterilization process. Question 73. The use of an autoclave for sterilization involves the use of. Here are the options. Option A. Dry heat. Option B. Chemical vapor. Option C. Steam. Option D. Steam under pressure. The correct answer is option D. Steam under pressure. An autoclave sterilizes by using steam under pressure. Question 74. Which of the following is not a chemical used in the unsaturated chemical vapor sterilization process? Here are the options. Option A. Acetone. Option B. Ketone. Option C. Glutaraldehyde. Option D. Formaldehyde. The correct answer is option C. Glutaraldehyde. Glutaraldehyde is not part of the unsaturated chemical vapor sterilization process listed in this flashcard. Question 75. What temperature is required for dry heat sterilization? Here are the options. Option A 350 to 400 degrees Fahrenheit. Option B 320 to 375 degrees Fahrenheit. Option C 375 to 450 degrees Fahrenheit. Option D 400 to 500 degrees Fahrenheit. The correct answer is option B, 320 to 375 degrees Fahrenheit. Dry heat sterilization commonly requires a temperature range of 320 to 375 degrees Fahrenheit. Question 76. What type of sterilization monitoring is used to determine if sterilization has occurred? Here are the options. Option A, physical monitoring. Option B, chemical monitoring. Option C, biological monitoring. Option D, physical and chemical monitoring. The correct answer is option C, biological monitoring. Biological monitoring uses resistant spores to verify that sterilization has occurred. Question 77. Chemical or liquid sterilization would be most appropriate for. Here are the options. Option A, rubber dam equipment. Option B, clamps. Option C, condensers. Option D, stainless steel hand instruments. The correct answer is option A, rubber dam equipment. Chemical or liquid sterilization is appropriate for heat-sensitive rubber dam equipment. Question 78. Which of the following statements is least accurate regarding dental unit water lines? Here are the options. Option A, the primary source for any microorganisms present in the dental unit water lines originates from the public water supply. Option B, water from dental unit water lines can be used for all dental procedures. Option C, anti-retraction devices can be installed in dental unit water lines to help prevent saliva from entering the water line during patient care. Option D, the tubing that connects the dental unit water lines to the handpieces can become colonized with many different types of bacteria or other microorganisms. The correct answer is option B. Water from dental unit water lines can be used for all dental procedures. Dental unit water line water should not be used for all dental procedures because surgical procedures require sterile solutions. Question 79. Clinical contact surfaces that have been contaminated by blood should be disinfected using. Here are the options. Option A, liquid chemical sterilant. Option B, high-level Environmental Protection Agency registered disinfectant. Option C, intermediate-level Environmental Protection Agency registered disinfectant. Option D, low-level Environmental Protection Agency registered disinfectant. The correct answer is option C, intermediate-level Environmental Protection Agency registered disinfectant. Blood-contaminated clinical contact surfaces require an intermediate-level Environmental Protection Agency registered disinfectant. Question 80. Which of the following is considered an intermediate-level disinfectant that can be used in the dental office setting? Here are the options. Option A, 6% hydrogen peroxide. Option B, 2% alkaline glutarol. Option C, iodophores such as iodo-5. Option D, sodium hypochlorite. The correct answer is option C, iodophores such as iodo-5. Iodophores such as iodo-5 are intermediate-level disinfectants used in dental settings. Question 81. What would be an appropriate alternative for a high-level disinfectant with low odor? Here are the options. Option A, isopropyl alcohol. Option B, chlorine dioxide. Option C, glutaraldehyde. Option D, orthophthaldehyde. The correct answer is option D, orthophthaldehyde. Orthophthaldehyde is a high-level disinfectant alternative with low odor compared with some other agents. Question 82. Which of the following statements about isopropyl alcohol is true? Here are the options. Option A. Isopropyl alcohol can be used effectively as a topical skin antiseptic. Option B. Isopropyl alcohol can effectively remove blood and saliva and any microorganisms associated with these. Option C. Isopropyl alcohol has a low evaporation rate, making it an effective disinfectant. Option D. Isopropyl alcohol is recommended by the Americans with Disabilities Act for the disinfection of environmental surfaces. The correct answer is option A. Isopropyl alcohol can be used effectively as a topical skin antiseptic. Isopropyl alcohol can be used as a topical skin antiseptic, but it is not recommended as a primary environmental surface disinfectant. Question 83. A low-level Environmental Protection Agency registered disinfectant is not effective against which of the following? Here are the options. Option A, human immunodeficiency virus. Option B, hepatitis B virus. Option C, influenza. Option D, aspergillus. The correct answer is option D, aspergillus. Low-level Environmental Protection Agency registered disinfectants are not effective against organisms such as aspergillus. Question 84. Which of the following would not be considered an advantage to using surface barriers in the dental office? Here are the options. Option A. Efficient use of time. Option B. Environmentally friendly. Option C. Protection of hard-to-clean surfaces. Option D. Provides a positive image of cleanliness to the patient. The correct answer is option B. Environmentally friendly. Surface barriers save time and protect hard-to-clean surfaces, but they are not environmentally friendly because they create disposable waste. Question 85. An advantage to using single-use disposable items in the dental office would be, here are the options. Option A. More efficient for difficult-to-clean items. Option B. Lower cost. Option C. Ability to reuse the items after sterilization if desired. Option D. Environmentally friendly. The correct answer is option A. More efficient for difficult-to-clean items. Single-use disposable items are helpful for items that are difficult to clean effectively. Question 86. How often does the exposure control plan need to be updated? Here are the options. Option A. Biannually. Option B. Annually. Option C. Every 3 years. Option D. Every 5 years. The correct answer is option B. Annually. The exposure control plan must be reviewed and updated annually. Question 87. The term engineering controls refers to all of the following except, here are the options. Option A. Sharps disposal container. Option B. Self-shearing needles. Option C. Needleless systems. Option D. All types of syringes. The correct answer is option D. All types of syringes. Engineering controls include safer devices and sharps containers, not every type of syringe. Question 88. Which of the following would not be considered a work practice control? Here are the options. Option A. Removing the burr before taking apart the dental handpiece. Option B. Avoiding the use of fingers in tissue retraction. Option C. Recapping a needle using a two-handed technique. Option D. Using the sharps container for disposing of used scalpels. The correct answer is option C. Recapping a needle using a two-handed technique. Two-handed needle recapping is not a safe work practice control because it increases the risk of a needle stick. Question 89. The Occupational Safety and Health Administration Hazard Communication Standard requires all of the following except, here are the options. Option A. Provide employees with efficient access to safety data sheets for all chemicals used on site. Option B. Proper training of employees regarding the use of chemicals in the workplace. Option C. Provides recommendations for what chemicals to use in certain situations. Option D. Preparation of a written plan for dealing with exposure to hazardous chemicals. The correct answer is option C. Provides recommendations for what chemicals to use in certain situations. The Hazard Communication Standard requires training, safety data sheet access, and a written plan, but it does not prescribe which chemicals to use. Question 90. What type of documentation is required by the Occupational Safety and Health Act of 1970 for a workplace injury that requires medical treatment beyond basic first aid? Here are the options. Option A. Report regarding the injury mailed to the employee's primary care physician. Option B. Documentation by the employer on a log and an incident report of work-related injuries and illnesses. Option C. The employer should request documentation from the emergency department or the patient's primary care physician on treatment provided for the workplace injury. Option D. Ask the employee to fill out an incident report. The correct answer is option B. Documentation by the employer on a log and an incident report of work-related injuries and illnesses. Workplace injuries requiring more than first aid must be documented on the required injury and illness records and incident report. Question 91. What is the appropriate first aid treatment for a chemical burn? Here are the options. Option A. Remove any remaining chemicals and rinse the area under cool running water for 15 to 20 minutes. Option B. Immediately put ice on the chemical injury. Option C. Place Vaseline or other ointment over the chemical injury. Option D. Put the area in ice-cold water, then cover the area with antibacterial ointment. The correct answer is option A. Remove any remaining chemicals and rinse the area under cool running water for 15 to 20 minutes. Chemical burns should be treated by removing the chemical and flushing the area with cool running water for 15 to 20 minutes. Question 92. What is the first step in treating a needle stick injury to a finger? Here are the options. Option A. Apply antibacterial ointment. Option B. Apply surgical disinfectant soap. Option C. Use soap and water to wash the affected area as soon as possible following injury. Option D. Wash with soap and water, then apply an antiseptic ointment. The correct answer is option C. Use soap and water to wash the affected area as soon as possible following injury. The first response to a needle stick injury is to wash the area with soap and water as soon as possible. Question 93. A needle stick injury has resulted in exposure to hepatitis C. Which of the following is not a recommendation for the first 6 months? Here are the options. Option A. Restriction from sexual activity. Option B. Leave of absence from work. Option C. Defer plans for starting a family. Option D. Blood donation. The correct answer is option D. Blood donation. After hepatitis C exposure, donating blood is specifically restricted, so blood donation is not a recommendation to continue. Question 94. What are the symptoms of nitrous oxide exposure? Here are the options. Option A. Difficulty breathing, headache, drowsiness. Option B. Skin rash and itching. Option C. Enlarged liver, abdominal pain, nausea. Option D. No obvious symptoms are present. The correct answer is option A. Difficulty breathing, headache, drowsiness. Nitrous oxide overexposure can cause breathing difficulty, headache, and drowsiness. Question 95. A patient has neglected to inform you of the development of a latex allergy. The patient begins to develop an anaphylaxis reaction during dental treatment. What should be done? Here are the options. Option A. Remove the source of latex and allow time for the patient to recover. Option B. The patient needs an injection of epinephrine. Call for emergency medical services. Option C. Call the patient's emergency contact for assistance. Option D. Give the patient oxygen and call the primary care physician. The correct answer is option B. The patient needs an injection of epinephrine. Call for emergency medical services. Anaphylaxis requires emergency treatment with epinephrine and activation of emergency medical services. Question 96. All of the following are appropriate steps to take for protection from lasers during dental care except for. Here are the options. Option A. Employee training. Option B. Standard eye protection. Option C. Use of matte finish instruments. Option D. Protection of outlying tissues that will not receive laser therapy with wet gauze packs. The correct answer is option B. Standard eye protection. Laser procedures require wavelength-appropriate laser eyewear, so standard eye protection is not sufficient. Question 97. Which of the following would be the least acceptable quality of an exit route in a dental office? Here are the options. Option A. The exit route should be free from stored equipment at all times. Option B. The exit route should be planned so that no combustible or explosive materials are stored along the way. Option C. The exit route should be free of doors that are able to be locked while trying to reach an exit. Option D. The quickest route out of the office. The correct answer is option D. The quickest route out of the office. An exit route must meet safety requirements, not merely be the quickest path out of the office. Question 98. How long is a dental employee required to keep the records of employees? Here are the options. Option A. The length of employment. Option B. The length of employment plus 10 years. Option C. The length of employment plus 20 years. Option D. The length of employment plus 30 years. The correct answer is option D. The length of employment plus 30 years. Employee exposure and medical records must be kept for the length of employment plus 30 years. Question 99. What is the name of the law that prohibits discrimination against patients who are human immunodeficiency virus positive? Here are the options. Option A, Americans with Disability Act. Option B, Human Immunodeficiency Virus Protection Act. Option C, Equal Rights Amendment. Option D, Health Insurance Portability and Accountability Act. The correct answer is option A, Americans with Disability Act. The Americans with Disabilities Act prohibits discrimination against patients who are human immunodeficiency virus positive. Question 100. Which of the following would not be an appropriate action for cleaning up a mercury spill? Here are the options. Option A, using a piece of tape to pick up the tiny mercury droplets. Option B, using a vacuum to pick up the mercury droplets. Option C, use sulfur dust to make a film on top of the droplets until they can be adequately cleaned. Option D, use an aspirator to pick up large droplets. The correct answer is option B, using a vacuum to pick up the mercury droplets. A vacuum should not be used for a mercury spill because it can spread mercury vapor and contamination. Question 101. The type of radiograph that would show the whole tooth, including the crown, roots, and jawline, is called. Here are the options. Option A, View X-ray. Option B, periapical X-ray. Option C, occlusal X-ray. Option D, tomogram. The correct answer is option B, periapical X-ray. A periapical radiograph shows the entire tooth including the crown, roots, and surrounding jaw area. Question 102. A bidoing radiograph is useful in diagnosing all of the following except. Here are the options. Option A, impacted tooth. Option B, tooth decay. Option C, periodontal bone loss. Option D, gum disease. The correct answer is option A, impacted tooth. Bidoing radiographs are useful for decay and bone loss, but impacted teeth are better evaluated with other radiographic views. Question 103. A full mouth series generally includes. Here are the options. Option of 14 periapical views and 4 to 6 bidoings. Option B, 10 periapical views and 8 bidoings. Option C, 14 periapical views and 4 to 6 bidoings and a panoramic. Option D, 8 periapical views and 4 bidoings. The correct answer is option A, 14 periapical views and 4 to 6 bidoings. A full mouth series generally includes 14 periapical views and 4 to 6 bidoings. Question 104. The best radiograph to obtain for the diagnosis of temporomandibular joint is. Here are the options. Option A, panoramic. Option B, periapical. Option C, scilography. Option D, arthrography. The correct answer is option D, arthrography. Arthrography is used to help evaluate the temporomandibular joint. Question 105. What type of radiograph is used by an orthodontist to assist with treatment planning? Here are the options. Option A, tomography. Option B, scilography. Option C, cephalometric. Option D, occlusal. The correct answer is option C, cephalometric. A cephalometric radiograph is commonly used by orthodontists for growth assessment and treatment planning. Question 106. Which of the following is a true statement regarding the use of lead aprons and thyroid collars? Here are the options. Option A. The use of lead aprons and thyroid collars will prevent cancer from developing in the thyroid gland. Option B. The apron should cover from the neck to just above the patient's knees. Option C. Lead aprons should be cleaned thoroughly and folded in thirds between patient use. Option D. The thyroid collar is optional for older adults past childbearing years. The correct answer is option B. The apron should cover from the neck to just above the patient's knees. A lead apron should cover the patient from the neck to just above the knees. Question 107. Where is the most appropriate place to store dental film? Here are the options. Option A. In a cool, dry closet. Option B. In a refrigerator. Option C. In the treatment room. Option D. Near the X-ray machine. The correct answer is option A. In a cool, dry closet. Dental film should be stored in a cool, dry closet away from heat, moisture, and radiation. Question 108. A dental assistant experiences an occupational exposure. A patient's blood has splashed into the employee's eye. Which of the following is an appropriate step to take? Here are the options. Option A. Immediately draw blood from the patient in order to get it tested for human immunodeficiency virus and hepatitis B virus. Option B. Require the employee to have their blood tested immediately for human immunodeficiency virus and hepatitis B virus. Option C. Document the incident, including the source individual, the employee, the route of exposure, and how it happened. Option D. Check the patient's chart and determine if risk factors are present to warrant further testing for the employee. The correct answer is option C. Document the incident, including the source individual, the employee, the route of exposure, and how it happened. An occupational exposure must be documented with details about the source individual, employee, route of exposure, and how it occurred. Question 109. Which of the following is false regarding hand washing? Here are the options. Option A. Alcohol-based hand gel can be used in place of soap and water on hands that are visibly dirty. Option B. Fingertips, thumbs, and between the fingers are three areas that are frequently not cleaned thoroughly with hand washing. Option C. Alcohol-based hand gel or foam should have a concentration of 60 to 95% alcohol. Option D. Cool water should be used to rinse hands after washing because it helps to close the pores in the skin. The correct answer is option A. Alcohol-based hand gel can be used in place of soap and water on hands that are visibly dirty. Alcohol-based hand gel should not replace soap and water when hands are visibly dirty. Question 110. A new patient has recently moved to the area and arrives for her first appointment in the dental practice. She is 6 months pregnant and is complaining of a toothache. She does not bring dental records with her. Which of the following would be the most appropriate for obtaining dental x-rays? Here are the options. Option A. Obtain a full mouth survey as well as a panoramic in order to establish a baseline. Option B. Only x-ray the area she is complaining about, using the lead apron and thyroid collar for protection. Option C. Hold off on any X-rays because of the pregnancy. Option D. Obtain a full set of bite-ring X-rays to check for other areas of concern using the lead apron and thyroid collar for protection. The correct answer is option B. Only X-ray the area she is complaining about, using the lead apron and thyroid collar for protection. For a pregnant patient with a toothache, only the area of concern should be imaged using a lead apron and thyroid collar. Question 111. What is the name of the device used to monitor employees for radiation exposure? Here are the options. Option A. Radiographometer. Option B. Oximeter. Option C. Holter monitor. Option D. Decimeter. The correct answer is option D. Decimeter. A decimeter monitors occupational radiation exposure. Question 112. For intraoral X-rays, what film speed is the fastest and reduces the amount of patient exposure to radiation? Here are the options. Option A. A speed. Option B. D speed. Option C. F speed. Option D. H speed. The correct answer is option C. F speed. F speed film is the fastest intraoral film speed listed and reduces patient radiation exposure compared with slower film. Question 113. Which of the following is used to control the degree of penetration of the X-ray beam? Here are the options. Option A. Exposure button. Option B. Kilovoltage peak selector. Option C. Milliamperage selector. Option D. Master switch. The correct answer is option B. Kilovoltage peak selector. The kilovoltage peak selector controls the penetrating power of the X-ray beam. Question 114. A reverse smile line observed on a panoramic image is likely due to. Here are the options. Option A. The position of the patient's chin is too high. Option B. The position of the patient's chin is too low. Option C. The patient's spine is not straight. Option D. The patient's lips were not closed during imaging. The correct answer is option A. The position of the patient's chin is too high. A reversed smile line on a panoramic image usually means the patient's chin was positioned too high. Question 115. A cone-shaped radiopaque image on a panoramic X-ray is likely caused by. Here are the options. Option A. Use of a thyroid collar during imaging. Option B. Earrings. Option C. Orthodontic retainer. Option D. Tongue piercing. The correct answer is option A. Use of a thyroid collar during imaging. A thyroid collar can create a cone-shaped radiopaque artifact on a panoramic image. Question 116. How does the use of photostimulable storage phosphor plates affect digital radiography? Here are the options. Option A. Photostimulable storage phosphor plates are the thickest form of sensor and are the most uncomfortable to the patient. Option B. Photostimulable storage phosphor plates allow for heat sterilization, making infection control easier to manage. Option C. Photostimulable storage phosphor plates provide slightly more radiation exposure to the patient than traditional dental film. Option D. Photostimulable storage phosphor plates do not offer immediate access to the digital image. The correct answer is option D. Photostimulable storage phosphor plates do not offer immediate access to the digital image. Photostimulable storage phosphor plates must be scanned before viewing, so they do not provide immediate image access. Question 117. Which of the following is not a disadvantage of digital radiography? Here are the options. Option A. Infection control issues. Option B. Lost images. Option C. Cost for purchasing digital imaging equipment. Option D. Training. The correct answer is option B. Lost images. Lost images are not a typical inherent disadvantage of digital radiography when images are properly saved and managed. Question 118. The use of outdated dental film may cause the X-ray to have. Here are the options. Option A. Partially missing image. Option B. White spots on the film. Option C. A foggy or gray appearance. Option D. Appearance of streaks on the final film. The correct answer is option C. A foggy or gray appearance. Outdated dental film may produce a foggy or gray image. Question 119. Which of the following would not be a reason for the dental X-ray image to come out black? Here are the options. Option A. Processing time is too short. Option B. Temperature is too warm. Option C. Film has been exposed to white light. Option D. Damaged safe light. The correct answer is option A. Processing time is too short. Processing time that is too short would tend to make an image lighter, not black. Question 120. What will happen to an X-ray film that is left in the processing solution too long? Here are the options. Option A. There will be white spots on the X-ray. Option B. There will be dark spots on the final image. Option C. The image will be either partially or completely missing. Option D. The X-ray will appear yellowish-brown. The correct answer is option C. The image will be either partially or completely missing. If X-ray film remains in processing solution too long, the image may become partially or completely missing. Question 121. A dental X-ray that has the appearance of a black line that looks like a tree branch is caused by. Here are the options. Option A. Overlapped films. Option B. Static electricity. Option C. Overexposure. Option D. Air bubbles. The correct answer is option B. Static electricity. A black branching mark that looks like a tree branch is caused by static electricity. Question 122. What type of chemical is used in the developing agent to convert the silver halide crystals to black? Here are the options. Option A. Potassium bromide. Option B. Sodium sulfite. Option C. Acetic acid. Option D. Hydroquinone. The correct answer is option D. Hydroquinone. Hydroquinone in developer helps convert exposed silver halide crystals to black metallic silver. Question 123. During manual processing, how long should the film remain in the developer solution if the temperature of the solution is 65 degrees Fahrenheit? Here are the options. Option A 8 minutes. Option B 6 minutes. Option C 5 minutes. Option D 3 minutes. The correct answer is option B. 6 minutes. At 65 degrees Fahrenheit, manual processing requires about 6 minutes in the developer solution. Question 124. Contaminated areas in the radiography area must be disinfected using. Here are the options. Option A, bleach and water. Option B, hydrogen peroxide. Option C, rubbing alcohol. Option D, hospital-grade disinfectant solution. The correct answer is option D, hospital-grade disinfectant solution. Contaminated radiography surfaces should be disinfected with a hospital-grade disinfectant solution. Question 125. What product in the dental office contains mercury? Here are the options. Option A, fixer agent. Option B, amalgam. Option C, fluoride. Option D, alginate. The correct answer is option B, amalgam. Dental amalgam contains mercury. Question 126. Disposal of an extracted tooth is considered to be. Here are the options. Option A, general waste. Option B, toxic waste. Option C, infectious waste. Option D, hazardous waste. The correct answer is option C, infectious waste. An extracted tooth is considered infectious waste because it has contacted blood and oral tissues. Question 127. Which of the following can be disposed of in the regular trash or down the drain? Here are the options. Option A, fixer. Option B, developer. Option C, chromium-containing X-ray system cleaner. Option D, expired amalgam capsules. The correct answer is option B, developer. Developer may be disposed of in the regular trash or down the drain according to this flashcard set, unlike fixer and amalgam-related waste. Question 128. When mounting dental film, which preferred order should be used? Here are the options. Option A, maxillary anterior periapical, mandibular anterior periapical, bidoing, maxillary posterior periapical, mandibular posterior periapical. Option B, bidoing, maxillary posterior periapical, mandibular posterior periapical, maxillary anterior periapical, mandibular anterior periapical. Option C, mandibular posterior periapical, maxillary posterior periapical, bidoing, mandibular anterior periapical, maxillary anterior periapical. Option D, maxillary posterior periapical, mandibular posterior periapical, bidoing, maxillary anterior periapical, mandibular anterior periapical. The correct answer is option A, maxillary anterior periapical, mandibular anterior periapical, bidoing, maxillary posterior periapical, mandibular posterior periapical. The preferred mounting order starts with maxillary anterior periapical images, then mandibular anterior periapical images, then bidoings, followed by posterior periapical images. Question 129. Which of the following do not include anatomical landmarks of the mandible? Here are the options. Option A, lingual foramen, coronoid process, ramus. Option B, incisive foramen, mental foramen, genial tubercle. Option C, medial sigmoid notch, symphysis, external oblique notch. Option D, trabecular patterns, alveolar crest, internal oblique ridge. The correct answer is option B. Incisive foramen, mental foramen, genial tubercle. The incisive foramen is a maxillary landmark, so that group does not accurately list only mandibular landmarks. Question 130. Which of the following are not maxillary landmarks? Here are the options. Option A. Hard palate, nasal septum, nasal conchae. Option B. Alveolar crest, genial tubercle, coronoid process. Option C. Infraorbital foramen, orbit, mastoid process. Option D. External auditory meatus, malar, glenoid fossa. The correct answer is option B. Alveolar crest, genial tubercle, coronoid process. Genial tubercle and coronoid process are mandibular landmarks, so that group is not a set of maxillary landmarks. Question 131. When identifying anatomical structures and dental materials on a radiograph, which of the following is true? Here are the options. Option A. The enamel is radiolucent and located at the crown of the tooth. Option B. The root canals are radiopaque and extend from the pulp chamber to the apex of the tooth. Option C. The periodontal ligament can be visualized as radiopaque. Option D. The dentin is not as radiopaque as enamel. The correct answer is option D. The dentin is not as radiopaque as enamel. Dentin is radiopaque but less radiopaque than enamel, which makes this statement accurate. Question 132. A patient is moving and asks for the most recent X-rays for the new dentist. Which of the following is not the preferred procedure for fulfilling this request? Here are the options. Option A. Obtain the original X-rays from the patient's record and give them to the patient to take to the new dentist. Option B. Prepare a copy of the film and allow the patient to take this to the dentist. Option C. Obtain contact information from the patient and mail it to the new dentist. Option D. Obtain an email address for the new dentist and send the digital images electronically. The correct answer is option A. Obtain the original X-rays from the patient's record and give them to the patient to take to the new dentist. Original radiographs are part of the patient record, so copies should be sent or provided rather than giving away the originals. Question 133. For manual duplication of X-ray films, which of the following conditions is incorrect? Here are the options. Option A. Film duplication must be completed in the darkroom with the safe light. Option B. Special duplication film must be used. Option C. Film duplication can be done in the regular office setting without any special conditions. Option D. The duplicating machine produces white light in order to expose the film. The correct answer is option C. Film duplication can be done in the regular office setting without any special conditions. Manual film duplication requires a darkroom, safe light, duplicating film, and a duplicating machine, not ordinary office conditions. Question 134. Characteristics of X-rays include all of the following except. Here are the options. Option A. X-rays are not visible or apparent to any of the senses. Option B. X-rays travel at half the speed of light. Option C. X-rays travel in a straight line, but can easily be deflected. Option D. Shorter X-rays are more useful in dental radiographs. The correct answer is option B. X-rays travel at half the speed of light. X-rays travel at the speed of light, so saying they travel at half the speed of light is incorrect. Question 135. In what part of the X-ray machine are the X-rays produced? Here are the options. Option A, X-ray tube. Option B, tube head. Option C, control panel. Option D, transformer. The correct answer is option A, X-ray tube. X-rays are produced in the X-ray tube inside the tube head. Question 136. What is the function of the collimator? Here are the options. Option A, directs the X-ray beam to the appropriate place. Option B, allows the E to cross over the cathode to reach the anode. Option C, forms the shape and size of the X-ray beam upon leaving the tube head. Option D, filters out the unusable wavelengths. The correct answer is option C, forms the shape and size of the X-ray beam upon leaving the tube head. The collimator shapes and limits the size of the X-ray beam as it leaves the tube head. Question 137. What is the term used to describe the number of E that are produced? Here are the options. Option A, kilovoltage peak. Option B, thermionic emission. Option C, milliamperage selector. Option D, kinetic energy. The correct answer is option C, milliamperage selector. Milliamperage controls the number of electrons produced and therefore the quantity of X-rays. Question 138. According to the American Academy of Oral and Maxillofacial Radiology, how often should an X-ray machine be tested? Here are the options. Option A, every 6 months. Option B, annually. Option C, biannually. Option D, every 3 years. The correct answer is option B, annually. The American Academy of Oral and Maxillofacial Radiology recommends testing the X-ray machine annually. Question 139. Which of the following would likely not be necessary in the case of an accidental radiation exposure? Here are the options. Option A, report the exposure to the Radiation Protection Office. Radiation Protection Office. Option B, turn the power to the system off immediately. Option C, advise exposed individuals to obtain medical care if needed. Option D, evacuate the building. The correct answer is option D, evacuate the building. An accidental radiation exposure may require reporting and shutting off power, but evacuating the building is usually not necessary. Question 140. Chronic radiation exposure to the lens of the eye may result in. Here are the options. Option A, astigmatism. Option B, strabismus. Option C, cataracts. Option D, glaucoma. The correct answer is option C, cataracts. Chronic radiation exposure to the eye lens can lead to cataracts. Question 141. What is the maximum permissible dose of radiation for a dental assistant? Here are the options. Option A, 5 rem per year. Option B, 0.5 rem per year. Option C, 10 rem per year. Option D, 50 rem per year. The correct answer is option A, 5 rem per year. The maximum permissible dose listed for a dental assistant is 5 rem per year. Question 142. Which of the following is considered secondary radiation? Here are the options. Option A. Radiation that goes through the collimator and position indicating device. Option B. Radiation that reflects off the patient's face. Option C. Radiation that leaks from the tube head. Option D. Radiation directed at an area for cancer treatment. The correct answer is option B. Radiation that reflects off the patient's face. Secondary radiation is scatter radiation that reflects from the patient's face or tissues. Question 143. Which of the following is not an effective way that the as low as reasonably achievable principle can be achieved in the dental office for the protection of the patient? Here are the options. Option A. Use of lead aprons and thyroid collars. Option B. Use of G-speed film. Option C. Minimize the time of exposure. Option D. Use of digital radiographs. The correct answer is option B. Use of D-speed film. Using D-speed film is not consistent with the as low as reasonably achievable principle because faster film or digital imaging reduces exposure. Question 144. What is the proper distance for the operator to stand away from the X-ray beam to minimize exposure? Here are the options. Option A 2 feet. Option B 4 feet. Option C 6 feet. Option D 8 feet. The correct answer is option C. 6 feet. The operator should stand at least 6 feet from the X-ray beam when no protective barrier is used. Question 145. Which statement best describes the effects of long-term low-dose radiation exposure? Here are the options. Option A. The effect of long-term low-dose radiation exposure will cause genetic defects for both men and women in their childbearing years. Option B. The effect of long-term low-dose radiation exposure will cause cancer. Option C. The effect of long-term low-dose radiation exposure can cause changes at the cellular level in the human body that would be observed within 2 years. Option D. The effect of long-term low-dose radiation exposure can cause changes at the cellular level in the human body that would not be observed for many years. The correct answer is option D. The effect of long-term low-dose radiation exposure can cause changes at the cellular level in the human body that would not be observed for many years. Long-term low-dose radiation can cause cellular changes that may not be observed for many years. Question 146. What part of the X-ray machine functions to remove the most dangerous X-rays from reaching both the patient and the operator? Here are the options. Option A. Aluminum filter. Option B. Collimator. Option C. Position indicating device. Option D. Milliamperage selector. The correct answer is option A. Aluminum filter. The aluminum filter removes longer wavelength, more dangerous low-energy X-rays before they reach the patient and operator. Question 147. A young patient is having difficulty holding still for X-rays. What is the most appropriate step for the dental assistant to take? Here are the options. Option A. Try again at the next appointment. Option B. Ask the parents to have the child sit on his or her lap with both covered by the lead apron. Option C. Ask the dentist to hold the child. Option D. Stand next to the child and hold the sensor in place until the X-rays are completed. The correct answer is option B. Ask the parents to have the child sit on his or her lap with both covered by the lead apron. Having the parent hold the child while both wear lead protection is safer than the dental assistant holding the sensor. Question 148. What is the correct way for a dental assistant to wear a dosimeter? Here are the options. Option A. Only when he or she is taking X-rays. Option B. All day, every day. Option C. Just during normal business hours for the practice. Option D. Only when he or she is at the dental office. The correct answer is option D. Only when he or she is at the dental office. A dosimeter should be worn only while at the dental office so it measures occupational exposure. Question 149. During what stage of pregnancy is the fetus most sensitive to the effects of radiation exposure? Here are the options. Option A. Weeks 2 to 15. Option B. Weeks 16 to 24. Option C. Weeks 24 to term. Option D. The entire pregnancy. The correct answer is option A. Weeks 2 to 15. The fetus is most sensitive to radiation exposure during weeks 2 through 15 of pregnancy. Question 150. What is the best possible scenario for a pregnant dental assistant in terms of employment? Here are the options. Option A. The dental assistant should quit her job immediately. Option B. The dental assistant should ask for a leave of absence starting in the 6th month. Option C. The dental assistant should make her decision as early in the pregnancy as possible regarding whether the risks to her unborn child are acceptable in her current position. Option D. The dental assistant should keep her pregnancy a secret until the risk of miscarriage has passed after the 4th month. The correct answer is option C. The dental assistant should make her decision as early in the pregnancy as possible regarding whether the risks to her unborn child are acceptable in her current position. A pregnant dental assistant should make decisions early in pregnancy about whether the work environment risks are acceptable.